have a goal of producing a medical record that will be completely electronic. And we identified a need to have a machine that would allow us to collect vital signs, validate them, and then display in our electronic medical record.
We needed our clinicians, including the physicians, to have the information real time, and we were really concerned about important data, such as vital signs being lost in somebody's pocket.
There was always a chance that you would be charting on the wrong patient, that you could transcribe the wrong numbers, or you lose that little Post-it note.
Our medical record is a Cerner product, so we were looking for a piece of equipment that was going to allow us, with our short timeline, to produce data. Our current equipment was not going to meet our needs. So we worked with administration, clinical IT, and the network administrator to find a machine that would do that. The Philips machine, the VS3, was incorporated into our Cerner system without much difficulty. And so we were very pleased with that.
I basically do all the networking, including the wired and wireless side here at the hospital. We have a very densely populated wireless network. The roaming was our biggest issue with the vital sign machine. Philips worked greatly with me to fix the issue through some programming on their end and some changes on our network.
Philips was great. We had a very short timeline in order to implement this machine within our facility, and they responded to all of our needs. They were here on our Go Live, helped us with our training, assisted with our education of the staff, and responded really well to any needs that we needed.
The Philips team has been very receptive. Anytime I had a question about how the device worked, etc., they were always there to answer my questions.
We were concerned that we were introducing a piece of equipment with our electronic medical record that would cause a lot of issues, and we did not have issues.
The implementation went really well. It was challenging at first to work through some of the issues that we had with our densely populated access point network, but the final outcome after rollout was a very successful thing.
I manage the data after the VS monitor sends it outbound. As far as I know, Philips is the only device that sends a result message outbound in HL7 format. That's very important. It enables us to, within seconds, post a result to the patient's chart.
Now we can either just find our information off the VS3 machine or just go right to the nurse server and click right in their electronic MAR, and all their vital signs are right there. You don't have to go searching for the paper things. It saves all that time of trying to find that.
Very easy. It's very smooth when you walk into a patient's room and you can able to get all the information into the VS3 and then process it into the computer system so the nurses and the physicians have it.
Well, I am sometimes technologically challenged, but this is a very simple system to use, and it doesn't interrupt the patient. Everything's right there, so you just go in, you're out in just a matter of seconds. This way, it electronically goes in almost instantaneously. You know that that's the patient's information and then that's correct.
We are able to validate that the information we're displaying in our electronic medical record is accurate.
The Philips devices work really well. We have minimal problems with it. I'm very happy with it.
From an IT standpoint, it works the way it should.
The VS3 has been wonderful to my life because I can get in there, do my vitals, visit with my patients more, and by the end of the day, it's all finished, and I know that I've done a real good job.
I am able to spend more time with my patients with this new system. It's made it a lot easier. It's streamlined the process of finding their vital signs. This way I'm able to just log right into their computer chart and then go in and take care of my patients. I feel like it makes me a better nurse.
This is a good demonstration of how the technology can assist the nursing workflow with a minimal disruption as we move towards the electronic medical record.
This is clinical IT at work.
This is really clinical IT at work.
This is really clinical IT at work.
This is clinical IT at work.